my name is Lacey Schooley and I'm from Wilson State College, and today I'll be demonstrating how to give IV meds. So the first thing I'm going to do is verify my MAR to my healthcare provider's orders to make sure that they're correct. So I have Shirley Koss, 4/3/1987, same doctor, and he has ordered us to give her 0.normal saline IV, 250 milliliters and 20 milliequivalents of potassium chloride at 125 milliliters per hour. I know this is clinically indicated because she has low potassium, and I just checked her labs. The other medication is morphine sulfate, 4 milligrams IV push every 2 hours PRN for pain, and I was just in the patient's room and she rated her pain a 9 out of 10. So I'm going to go ahead and get the morphine ready to give her that. So now that I've checked my MAR and my healthcare provider's orders, I'm going to go in the med room, perform hand hygiene, and get my medications ready. So the first medication that I am going to prepare is the morphine sulfate. I know through dimensional analysis that my 4 milligrams of morphine sulfate is 0.4 milliliters diluted in 1 milliliter of normal saline. So I pull my vial of morphine out of Pyxis and I'm going to compare it. Morphine sulfate, grams, perfect. Okay, so I'm going to clean the top of this vial. Circular motions for 10 to 15 seconds. Okay, while that's drying, I'm going to get my 3 milliliter syringe and my filter needle. Going to draw up 0.4 milliliters of air. Okay, and the vial top is dry, so I'm going to inject the air, invert my vial. Okay. Have my second nurse verify. Oh, and I see a little air bubble. So, verify the 0.4 milliliters, and I'm going to recap this while I get my normal saline ready. Okay, and I know this is sterile, so I can just go ahead and take off the cap. Take off this cap. Okay, and I'm going to draw back to 0.14, or 0.4, excuse me. Okay. Then I can have. Okay. Then I'm going to take off this, put it in the sharps container, and put a sterile cap on. That way I'm not walking in the halls with a needle. Okay. Okay, so then I have my morphine sulfate for 0.4 milliliters with my 1 milliliter of normal saline. I'm going to go ahead and label this. Put this around my syringe so I can do my third medication check in the patient's room. Okay, and set this aside. And now I need to go ahead and get my potassium chloride ready. So I need 0.9% normal saline, 250 milliliters, 50 milliliters. Okay. So I'm going to squeeze the bag to make sure there's no hole that's not been tampered with. So my 0.9% normal saline. Okay. It's not clear, or it's clear, it's not cloudy, and it's not expired. So I know I'm going to go ahead and give this going to clean the top of this vial. And I need 20 milliequivalents of potassium chloride, and I know through dimensional analysis that is 10 milliliters. So I have my 10 ml syringe. I'm going to get this ready while my vial top is drying. Okay. Okay, so I'm going to inject 10 ml of air to my vial. Invert it. Okay, normally this would be inverted, but this vial's been used multiple times, so it's struggling to. Okay, so I have my 10 ml of potassium chloride. I'm going to put my filter needle back on, and then my 0-point normal saline. I'm going to clean the injection port. Okay, and let that dry. Inject this and make sure not to puncture the bag. Okay, I can throw that in the shirts container, and I'm gonna mix this. Just tilting it back and forth. Okay, now it's mixed. I can go ahead and label it. So I have my potassium chloride label here, and I'm just going to make sure that everything is correct on it. Potassium chloride, potassium chloride. Okay. That way, the next nurse coming on or checking knows that there's medication in this bag. And I'm also going to put a patient label on it, and I'm just going to make sure all my information is correct. Perfect. I'm going to put the date and the time, and my initials, and put this on the back of the bag as well. Okay, so now that I have both my potassium chloride and my morphine prepared, and I've done 2 medication checks, I'm good to go into the patient's room. So normally I would have a tray to put everything on that I need to make it easier to transfer into the patient's room. I'm gonna take these so I can scan them. Okay, so now I'm in the patient's room. So I'm going to knock, perform hand hygiene, and verify my patient. Hi Shirley, my name is Lacey. I'm going to be your student nurse today. Can I have you verify your name and date of birth? Shirley Koss, 4/3/1987. Perfect. Do you have any allergies to codeine? Okay, and that's what I have here. So Shirley, I have 2 medications to give you. I have potassium chloride that we're going to give you IV because your potassium level is low from vomiting. And then I also have some morphine to give you for your pain, okay? Okay, do you have any questions before we start? No? Okay. So the patient understands both of the procedures, so I'm going to put on gloves. Okay, Shirley, we're going to give your morphine first. first, okay? Okay, so the first thing I'm going to do is clean the saline lock. Okay. Then I'm going to flush the IV to make sure it's still patent. Okay, so I'm going to pull back until I see blood. And once I see blood, I'm going to go ahead and flush. Do you have any pain or anything, Shirley? No? Okay. And I don't see any redness or swelling, so that is good. Okay, and then I'm going to do my third medication check. So I have morphine sulfate, 0.4 milliliters. Perfect. Okay, Shirley, now we're going to go ahead and give you your morphine, okay? Okay, so in a normal clinical setting, I would give this morphine over 2 minutes. Okay, and then I'm going to flush it again with normal saline to clear out the line of any medication that's left over. Okay, so then after that's done, I'm going to close this lock and get my IV potassium ready to go. Okay, so then now that I'm done with this vial, I'd make sure to go back to the medication room after leaving my patient's room to waste this with another nurse. So I'm going to do my third medication check. So I have my 0.9% normal saline with 10 mils of potassium chloride. I just used the bottle to scan it. So I'm going to spike my bag. I would also make sure that I have a new primary IV kit, but since we're reusing it, that's what I put in. Okay, so hang it. Squeeze this cylinder till it's half full. And everything's closed on it. I'm going to invert it, open. And once it fills, back up. Just helping it along since it's been used before. Okay, now that both are closed, okay, so it would drip, and then we know the IV tubing is primed. Put this back on to keep it sterile since it didn't touch anything. Inspect the line for any air bubbles, and it is none. Okay, so now we are I'm going to clean her normal saline lock one more time, just to make sure that it's clean before I attach her IV. Okay, so I'm going to attach the IV to get the potassium infusing. Open this, make sure everything's open here, set the pump to give 125 milliliters per hour. So I know that the infusion is going to take around 2 hours. Okay, Shirley, so I'm going to come back in 2 hours to get you disconnected after the potassium is done running, okay? Okay, so then I would document the start time, stop time, and now 2 hours has gone by, so I'm going to get ready to discontinue Shirley's line. So come in, the IV pump is beeping, stop it. I'm going to get my blue cap ready. That way if Shirley needs IV fluids again, I can use the same IV tubing because I know that it is sterile. So I'm going to clamp off her normal saline lock. Just connect it here and apply my blue cap. Hang it up. Okay, and then since there was medication running through, I'm just going to flush her saline lock just to make sure that all the medication is through and that it's still patent for future uses. Okay, Shirley, you having any pain at all? No? Okay, and there's no redness or swelling. Close this. Okay, and close the lock. Then I would clean up my workspace and make sure Shirley didn't need anything else. She had her call light, and then I would document, like I said, the start time, stop time of the potassium chloride, her pain, how she tolerated the morphine, and then her pain reassessment. And then I would go back to the med room and waste my morphine with another nurse.